Thank you. Great. Thanks for having me, everyone. So my goal here today is to give you some take-home information so that you will be able to understand the applications of acupuncture as it relates to pain. My training as a naturopathic doctor spans about 10 years. I went to medical school out west in Seattle. And after returning here, I was in private practice for about 10 years. And then when the Connor Integrative Medicine Network opened about 4 years ago, I joined them and I've been there for about 3 years. We offer a wide range of services that are complementary. We get lots of referrals from different physicians in all areas. And the modalities that we offer are acupuncture, of course. We have clinical hypnotherapy. We have integrative medicine consults from one of our integrative physicians. Integrative psychiatry. We also have a life coach. We have massage therapy, also something called MFR, which is myofascial release. It's a form of massage. We also have meditation, mindfulness classes. We have a private yoga therapist, a reflexologist, and someone who does Reiki. And music therapy. We have 3 music therapists who also do inpatient therapy for people, and they're out in Bedford and also here at Case and at Ahuja. So today we're going to talk about acupuncture and how it relates to pain and what are some of the indications, some of the theories behind it. And so let's just start with the topics. First we'll start with the history of it. We'll define it in both Eastern and Western terms. We'll talk about some common conditions that acupuncture can be applied for. And then lastly, we'll talk about some research and where that's taking us today, some of the benefits, and then we'll have some time for Q&A. All right, so the history of acupuncture. So what we know, it's between 2,000 and 5,000 years old on written document, but could be older. Some of the first acupuncturists were actually blind, so they used their sense of touch to find where these meridians or channels are, and I'll talk a little bit about those in the coming slides. So acupuncture is actually practiced in most countries today. So that's quite interesting how widespread the use of acupuncture is, not only in China, but pretty much everywhere in Europe, South America, North America, here obviously in the United States. As far as legalization of it, it was about in the 1970s when it started. Nixon was actually in China, and he had one of his secretaries there doing a news report who had to go to the hospital for some reason, and then that news reporter brought it back to America and shared that with the world that he had acupuncture. And so then we have this huge history of schools popping up, but actually there were people from China already here in America doing acupuncture. So they were doing it before the 70s. It just became more legal and accepted after that time. Okay, so just a few acupuncture statistics here. Currently, there are about 60 schools in the United States and about 21,000 acupuncturists. I want to say now that's probably up to 22,000. I think this is about a year old. And currently, 1 in 4 hospitals are offering acupuncture or some form of complementary or alternative medicine. So that really shows us that the people are desiring it, and it's becoming more accepted as we do more studies to show that there are some effectiveness for these therapies. The World Health Organization has listed about 104 indications for acupuncture, and we'll talk a little bit more about that. Okay, so how popular is it? We have about 3.1 million Americans visiting in 2007, so if you estimate that to now, we can say about 4.5 million Americans have visited acupuncturists. So I've heard the statement or the conundrum, well, just because something's popular doesn't mean it works. Well, that is true. However, we'll go on and explain how there have been studies that show that acupuncture is actually effective in not only physical pain, but emotional and mental pain as well. So how are the physicians getting to us? So actually at our department, a small number of physicians refer. It has been increasing over the past 3 years, but we're seeing an increase in just the patients that show up. They refer friends and family, you know, we're getting some traffic on the website now. So, but we would really like to spread the awareness of acupuncture to all departments so that they can understand what illnesses and conditions that acupuncture is used for. Okay, about 1 in 10 adults in the U.S. have visited an acupuncturist. Again, that number is increasing. All right, so what is acupuncture? So it's not this, okay? Let's see. It's not this guy here with the porcupine, and it's definitely not this guy here either. So we are not putting needles everywhere and making you a pincushion, so that's not the point of what we're doing. So let's show actually what acupuncture is. Oh, I actually put this on there because I thought this was funny. So this cartoon here says, "That's odd, my neck suddenly feels better." And you see these like sort of Neanderthal type people sticking these bamboo type sticks into the end of a mammoth here. So this probably was early acupuncture at some point. So let's see. I think somehow this might not be the right. Oh, here. Okay. So how is acupuncture defined? All right, so acupuncture is defined as placement of tiny, hair-thin needles into acupuncture points on the body. The idea is that it's stimulating something called qi. We'll talk about that in a minute. And it sends signals to the nervous and immune systems. And in turn, it will inhibit pain and resolve the disease process. Let's go down here. Okay, there are a few other branches of traditional Chinese medicine in addition to acupuncture. There's acupressure, which is basically just putting manual pressure on points and leaving it there. There are some massage therapists who do trigger point therapy. It's not actually acupressure unless they've been trained in where the channels or meridians are. There's moxibustion, which uses an herb that can be placed on the needle and the heat goes into the system. Or you can actually use a handheld. It's sort of in the shape of a cigar, and you hold it over certain points, indicated for people who have a cold condition, which is a Chinese diagnosis. Someone could have cold in one of the channels. Chinese herbs. People use herbs that are in formulas. They use teas. There's also Tui Na, which is a sort of massage manipulation type of therapy. There's Tai Chi and Qigong. Tai Chi is a movement. They call it meditation in motion. Tai Chi is still done today in Tiananmen Square at about 5 in the morning, if anyone's ever been there. Qigong is also a sort of meditation in motion idea where people are moving their body in certain lines of the channels of the body. And then, of course, diet and lifestyle, and that spans Eastern and Western. Okay, what is the theory in Eastern concept of what this qi is? So qi is defined in Chinese medicine as the life force. It's basically the energy that the body has, okay? So as you can see here on this chart, this is some of the channels on the back, but the channels run front, side, back of the body from head to toe. Each major organ is associated with a channel. So there's a heart, liver, lung, so on and so forth channel. And it's determined in Chinese medicine when you read the theory is that when these channels get blocked for a variety of reasons, diet, lifestyle, genetics, physical, mental pain, mental and emotional pain. So when there's a blockage there, then you have pain. And the idea is when we put acupuncture in certain spots, that releases that blockage. There is something called dry needling. Some of you may have heard that. That is not a form of traditional Chinese medicine. Some physical therapists do dry needling technique, which is it's an offshoot of acupuncture, but it's not traditional Chinese acupuncture. But it has shown some effectiveness in a few studies, not a lot, but you will hear of this dry needling being done by PTs. Okay, so here are the meridians, as you can see. Again, they run front, side, the back of the body. The front of the body has the liver, stomach, and spleen channels on the bottom of the body. On the back, there's the longest channel, the urinary bladder, and the kidney channel. So how many points are there? We have an estimate about 365, excuse me, but there's probably over an abundance of about 500. And this is a combination of other points being used in Thai acupuncture or Korean acupuncture, even Japanese acupuncture, and auricular ear acupuncture. So 365 is what's in the books in traditional Chinese medicine, but it's extended to at least over 5,000 and maybe even, 500 or maybe even more. So where are these points located? They're located in areas of low skin resistance that are rich in blood and nerve supply. They don't necessarily run along the nerves and arteries, but they're in the areas. They're typically found in a depression in between a bone or ligament and a tendon. This is why when we go to school, we have to learn quite a bit about our anatomy, because you need to know where you're going with the needles to make sure that you're not going to be causing harm. Okay. All right. I think we talked about that. All right. So another theory in Chinese medicine that's used is that, again, each organ has a channel, and each organ also has what's considered a paired organ. So on the liver channel, it's a paired organ with the liver and the gallbladder. Obviously, they're close to each other anatomically, and there is an element of also that in association with it. So as you can see here on this chart on the right, each organ is related to an element. So liver, gallbladder is related to the wood element, kidney, urinary bladder is water, heart, small intestine is fire, stomach and spleen is earth, and lung and large intestine is metal. Okay, so expanding this a little bit more, these associations can relate to not only elements on Earth, but seasons, climate changes, body tissues. As you can see here, the water under kidney is bones, wood is the sinews, fire is the blood vessels, earth is muscles, and metal is skin. And there's also an association with organs. There's an association with emotions. So the organs have emotions associated with it. So one of the great things about acupuncture is that it can help address emotional imbalances. And when we have an intake with the person, we are typically asking them how the emotional state is of the body, because we understand that certain emotions specifically will impact one or more of the channels. So if somebody comes to me and says they've got anxiety, then I'm typically looking over to the stomach and spleen, sometimes the heart channel, but stomach and spleen is worry, and typically they'll have digestive issues. So I'm going to be focusing on the stomach and spleen channels on certain points that will help that digestion. Okay, so that's just one idea of how an association plays out. Okay, so some of you may have seen this symbol before, this sort of circle with this S shape with the two dots. That's the yin and yang symbol. That's another theory in Chinese medicine that's used, that the acupuncture is actually trying to balance this yin and yang in the body. So what is this yin and yang in the body? So we understand it as, if you're reading there on the left, yin is correlated to the fluids of the body. There's night, dark, cold, negative, passive, female, liver, lungs, and kidney. The yang is more of the daytime energy from the sun. It's light, positive, male. Even children have a lot of yang energy. Gallbladder, small intestine, stomach, large intestine, and urinary bladder. All right, so let's go on to the Western theory. So Western theory didn't start being studied until probably about 20 years ago. So it's still new in its infancy, but it's showing promise in some applications today. So one of them is the neurotransmitter theory, that endorphins get released, causing analgesia. And then there's also been studies that white blood cells get increased. There's also inflammation that can be lowered. So the neurotransmitter theory, it goes a little further, in the idea is that it can stimulate the secretion of your beta endorphins, your enkephalins in the brain and spinal cord, hence reducing your pain. This will influence the immune system and your anti-nociceptive system. All right, the second theory is the autonomic nervous system. This one is the same idea, that the hormones are being released in the brain and the spinal cord, releasing norepinephrine, acetylcholine, lots of opioids. Basically, this is affecting the turnover rate of these hormones in the body and normalizing the autonomic nervous system. The third theory we know is the vascular interstitial theory, that acupuncture can affect the electrical system of the body, creating this enhanced closed circuit transport in the tissues. This will facilitate healing by allowing the transfer of material and electrical energy between the normal and the injured tissues. Okay, the fourth theory is the blood chemistry theory, that acupuncture affects the blood concentrations of triglycerides, cholesterol, and phospholipids, the outer coating of cells. This also can increase or decrease the peripheral blood components and then releasing the body towards a state of homeostasis. The fifth one here is called the gate control theory. This activates again the non-nociceptive receptors, inhibit the transmission of nociceptive signals in the dorsal horn, and gating out the painful stimuli. Okay, so what does the MRI scientific study show us? To me, this was very interesting. I think in one day, maybe in about 10 years, I'm hoping that we'll be able to put acupuncture needles in all of the bodies or in all the channels, and we'll be able to see how it's lighting up the brain. We're not there yet, but I'm thinking in about 10 years we'll probably be there. So they have done a few studies, not many, but a few, to explain that there is a possible mechanism of, again, the acupuncture analgesia, again with the anti-nociceptive pathways, and it can decrease the activity in the areas of pain perception in the brain. Okay, so let's move on to benefits. So benefits of acupuncture as a complementary option. One of the main reasons people come actually to acupuncture, unfortunately I have to say, is because they've tried everything else. So this isn't the best case scenario for us, because at that point, typically we're looking at many treatments for people. It doesn't always happen that way. People always surprise me, and they maybe come in with 3 herniated discs, and I've only done 2 treatments and they're pain-free, and I get surprised. But you'll always have those kind of rare instances. But yeah, most people are coming in at the worst time, meaning that they've tried everything, therapy, pharmaceutical-wise, and they're looking for some drug-free relief. So it's a safe and effective treatment option for many people, rare to minimal side effects. A lot of people actually either can't take more pharmaceuticals or they don't want to for the side effect reasons. So that's another reason people are coming to acupuncture. Another reason is that a lot of people have gotten other benefits from acupuncture not related to their pain, meaning that they have increased energy or their sleep is better. A lot of times they will say their immune system feels enhanced if they've been coming for a while. And the last item here is that financially, when we see people for what are called maintenance treatments once a month, their health improves, and down the line, that's a long-term cost that will help decrease their need to go to see doctors often. Okay. Okay. Some other benefits are, so a lot of times we can improve pain or resolve it altogether. And this is usually done over a period of time, usually weekly, for at least 8 to 10 sessions. Doesn't always take that long. Some people, again, will respond after 2 sessions, but most people generally need about 6 visits to notice any improvements. Okay. Again, I think I mentioned that a lot of people, they will tell me their immune system just feels better. Overall, their sense of well-being has improved after a number of treatments. Their sleep typically improves. They can recover from sports injuries a little bit faster. And some people have been able to miss less work days if they come in for treatments and it's affecting their work. After a number of treatments, they will have expressed that they're able to miss work less. All right, some other medical benefits are fewer visits to physicians, fewer prescription drugs, less side effects, and some people have been able to avoid surgery if they were recommended to have surgery, so that's always nice. All right, let's talk about some specific pain conditions that acupuncture is used to treat. So the World Health Organization has listed about 104 indications for acupuncture. This is a very small version of that. A lot of those indications are for pain, but again, not all of them for pain. High blood pressure, for instance, anxiety, depression, these things are not pain related, but have shown some benefit with that. So we'll go down the list here. So there's dental pain, including TMJ. That's also pre and post-operative. They've been showing people that get relief post-operative dental work. Okay, they actually do a lot of dental anesthesia in China. It's very common if you go there to not have any sort of analgesia given, and they'll just do acupuncture, and people are able to get teeth pulled and have work done on their mouth. I'm always amazed at that. I think to myself, gosh, if I went there, would I do that? And I probably would, just because I've been doing acupuncture now for over 10 years, and that would be a little hypocritical if I didn't at least try it. All right, digestive pain, including IBS, constipation, diarrhea, even reflux. ENT, a lot of ear, nose, and throat issues, ear pain, sinus issues for people. I see a lot of people with allergies. Gynecological issues, including PMS. It can range from the premenopause to the perimenopause, even menopausal issues. Even fertility. Acupuncture is great for fertility. It's been shown to help increase by at least by 30% the chances of conceiving with IVF. Musculoskeletal, that's one of the common things we see is neck pain, back pain, headache, a lot of shoulder, frozen shoulder issues. Respiratory, don't see too many issues. A lot of people do come with COPD and hoping that acupuncture is going to be helpful. Maybe helpful to a very small degree, but actually not as helpful when you're in a stage that's far gone. Okay, chronic fatigue and fibromyalgia, I should have put that one in there too. Those are some issues that people have a really hard time finding any sort of relief. And acupuncture, when done correctly, can really help this population. Immune disorders, I won't talk too much about that. And then nausea. Nausea in pregnancy or chemotherapy has been shown actually in quite a few studies that it's very helpful for people pre and post chemo. A lot of women going through their pregnancy stages, whether it's nausea and vomiting beforehand, first 3 months, or I've actually had women want to be induced and they don't want to have Pitocin, or they're overdue a couple weeks, will actually come in and use acupuncture for induction. Okay, so let's see some of the research. I tried to get some of the most recent articles, so it was, because with research now, it's been changing a lot in the past 5 or 10 years. So this research article from the JAMA Internal Medicine from 2012 showed that acupuncture for chronic pain with an individual patient data meta-analysis was very effective, and that acupuncture should be used as a reasonable option, and that it was shown that it was more helpful than a placebo. So with research with acupuncture, it's challenging because there's a lot of variables, and we'll talk about that in a few more slides. This other research study came from the Evidence-Based Complementary and Alternative Medicine Journal, showing that efficacy and safety of acupuncture for acute low back pain in emergency department visits had shown that it could improve an immediate effect in reducing pain of acute low back pain significantly. All right. So I thought pediatric population should at least get a slide here. So we don't have a lot of research in this population only because for the most part there's that fear of the needle, and that's understandable with children, right? They have been exposed to needles since very early on in infancy. So we're not really there yet with the studies. There have been a few promising studies. This one's from the Pediatric Clinics of North America. The title is Acupuncture for Pediatric Pain and Symptom Management. Showed again the perception of the fear of needles was contributing to less evidence, but that there were a few studies shown on people who had some chronic illnesses that it was effective. And it was less effective when they were shown a demonstration beforehand to sort of allay those fears. Okay, so some of the challenges. There are probably about 21,000 studies. If you go to PubMed, you'll see about that many number of studies. So we have a good number of studies, but not a lot of high quality random controlled studies being done. So some of the issues are methodology, selection of the controls. Being able to blind is difficult because you know, the acupuncturists, if they're professional and not a stand-in, you know, they know where the points are, and so blinding them is a little bit difficult. They have been doing sham acupuncture, meaning that instead of inserting a needle, they'll just place a magnet or some sort of sticky object on a point. There's also the individual skill of the acupuncturist. There are different types of acupuncture, the most common being traditional Chinese acupuncture, but again, there's Japanese, Korean, Thai. So we're still sort of in infancies on high quality, but it's promising. And again, I think in the next 10 some years, we'll be seeing more scientific studies done with MRIs and whatnot. Okay, so let's talk a little bit about the needles. A lot of people don't come to acupuncture because they have fear of needles, and that's very understandable. So the research tells us there's a minimal amount of bruising. 1 to 3% of people will have this. A little bit of bleeding, but no more than a couple drops. Even when people are on Coumadin, being on a blood thinner or even on a steroid for too long doesn't show any sort of complication. Some people do get lightheadedness, especially if they're elderly, if they've been laying down too long, so you need to be careful of that. There is a rare broken needle issue, very rare. Pneumothorax is very rare, actually, and infection. So I think in about 20,000 people they studied, maybe only 2 to 4% had these rare occurrences. Okay, so the needles, again, they are FDA regulated. They are hair-like. The gauge is typically about 32 to 36 millimeters. They're solid stainless steel, and there's no medication on them at all. In China, they actually are doing some progressive therapies with acupuncture. They're actually injecting things into acupuncture points. They've injected certain Chinese herbs. They've tried echinacea, so that's still in its infancy, but showing interesting research nonetheless. The needles do not go into your nerves or arteries and veins. They're going around these structures. And again, most people will feel like a light pressure, a sense that something is there, but it should never be numbing, burning, or stinging. And we always have communication between the therapist and the patient. The retention time is about 30 minutes, give and take 10 minutes either way. Sometimes if people are comfortable and they want to stay longer, 45 minutes is usually the max. So what do these needles look like? So the thickness, as you can see on the left here, you're comparing a paper clip to one of the needles. We've got a thickness of about 0.12 to 0.3 millimeters. On the right here, you can see a comparison chart of a matchstick to a medical syringe, sewing needle, and an acupuncture needle. And the lower left hand picture there is a picture of a hypodermic needle showing about 35 acupuncture needles going into that hole right there. So that kind of gives you an idea that these needles are cat whisker-like. They're very thin. Okay. So we're at the end of the talk. I think we left about 10 minutes if anyone has questions for me. Well, thank you everyone for being a wonderful audience. Have a great week, the rest of Pain Week, and thank you for having me.
Thank you so much. I appreciate it. Thank you.